Hi everyone and welcome back to the Hair Loss Show. In today's episode, we're going to talk about the top 5 oral medications to use for androgenic alopecia. So stick around. Hi everyone, welcome back to the show. We're going to talk about the top 5 oral treatments for hair loss in 2025. We're going to rank them in order. So let's get straight to it. So hair loss, something that affects both men and women, and it can be emotionally fraught. And so if you are experiencing hair loss, make sure that you see your prescribing physician, make sure that they're good and used to managing hair loss conditions, and they'll get you on the right track. But let's go through our list. All right, in number 5 in the top medications for hair loss, I'm going to put spironolactone. Now, spironolactone is something that we use very commonly in women to help manage female pattern hair loss. And how it works is specifically it blocks what we call the androgen receptor. So there's still a lot of these androgens floating around in the system that can, once it binds to the receptor, result in the effect that will cause the hair to miniaturize and shed as well. And so by blocking that receptor, you block the effectiveness of that sort of combination to happen. And so spironolactone is actually a weak blocker of the androgen receptor, and so we can use that. And generally we start at a low dose and build up as the patient tolerates. So that has been shown to be useful. It's not the mainstay of treatment by any means with regards to female pattern hair loss, but we can use it as well. I don't necessarily use it in men. It can cause, one of the side effects it can cause is gynecomastia, which a lot of men don't want. So that's spironolactone. Number 4 in terms of oral treatments for hair loss is bicalutamide. And this is something that prostate medication, but we can use it both in men and women to help with androgenic alopecia. And similar to spironolactone, it works by blocking that androgen receptor as well. So it's a little bit more effective at doing that. And so therefore helps prevent the net effect of what is causing the hair loss in the first place as well. So bicalutamide can be used and it needs to be prescribed for you as well. Number 3 in my list of top medications for hair loss in 2025 is minoxidil. I love oral minoxidil. I think it's fantastic. I love topical minoxidil, but I like oral minoxidil even better. Minoxidil is great. It initially came out as a blood pressure medication, but they saw that people that were taking that experienced a lot more hair growth. And so we can give minoxidil very inexpensively to people. That helps stimulate the hair. So it basically prolongs that anagen phase, that growth phase of the hair cycle, thickens up the hair follicles as well. And so it's really good for someone who's experiencing hair loss or hair shedding, can try and stop that as well. So it's good not only for androgenic alopecia, but also chronic hair shedding called telogen effluvium. It's a really mainstay of treatment with regards to that as well. And it's important to get the dose right, okay? So you can start low, like 1 milligram, 1.5 milligrams, build up generally to 2.5 milligrams. You can go higher, but I'm always very careful and mindful of going at a higher dose because it can drop your blood pressure, and you've got to be careful, especially if you have blood pressure issues. If you're an older person, you don't want to have that drop in blood pressure unnecessarily. But it's a great medication. From a safety perspective, there's no other side effects other than it can also cause a lot of what we call hirsutism, which is hair growth everywhere, which is a problem for a lot of people, especially if you're female, you don't want to become hairy. But if that's happening, as a side note, you can understand that it actually is working, it is being effective. So certainly oral minoxidil, really great, is a staple for a lot of people who are experiencing hair loss. Number 2 on my list of top hair loss treatments is finasteride. Finasteride for a lot of people is the low-hanging fruit with regards to treatment of androgenic alopecia. We've talked a lot about finasteride on this channel. It blocks the conversion of testosterone to dihydrotestosterone. So you're trying to reduce that level of dihydrotestosterone in the system. You're not trying to get it down to 0, you're just trying to bring the level below a certain threshold for that individual patient. And so we need to titrate the dose, all right? So you don't necessarily, not everyone needs to take 1 milligram a day. Sometimes people take less. Generally, we start at 1 milligram every other day, so 3 milligrams per week, and we found that that is actually the sweet spot. One of the things that a lot of people worry about are the side effects associated with finasteride. Generally, the incidence of side effects associated with finasteride is quite low, probably about 1 to 2% of the population. That said, the side effects that people experience can be sexual side effects. There can be issues with mental health as well. So if you are experiencing that, make sure you speak to your prescribing physician. And then we can either stop the medication or alter the dose accordingly. So that's good. But the limitation with finasteride is that it only blocks one type of the enzyme, the type 2 version of the enzyme. So it is effective for most people. It's been around a long time. It's FDA approved for hair loss, especially specifically androgenic alopecia. And so I think finasteride is great. And yes, like I said before, is the low-hanging fruit for most people who are starting on their journey of hair loss. And number 1 on my list of oral medications for hair loss treatments in 2025 is dutasteride. All right, so dutasteride, another 5-alpha reductase inhibitor, but this time it blocks both the type 1 and type 2 versions of the enzyme. And so that's really good from a perspective of being able to modulate that dihydrotestosterone level. And so it can be more effective. So in people that either are not stable on finasteride, you can then switch them on to dutasteride or add dutasteride into their treatment regime, and we found a lot of times that does help. There are, for reasons I cannot explain, there are people that cannot tolerate finasteride that can tolerate dutasteride as well. So that's worthwhile to have that discussion with your prescribing physician about that. But here's the thing, and you have to be mindful of this as well, dutasteride is an off-label use for hair loss. All right, so it's not in Australia TGA approved for hair loss, so you are using it as an off-label prescription medication. But those are my top 5 in terms of oral medications for hair loss. I hope you found that useful. Thanks again for watching, and we'll see you on the next episode.